Careblazer, have you noticed your loved one significantly leaning to one side, either while they're walking or sitting down? This is more than just getting older. It could be something called Pisa Syndrome, named after the Leaning Tower of Pisa, because that's exactly what it looks like. They are leaning so much to the side. And let's talk about how it shows up in people with dementia and especially Parkinson's disease, and how some medications can even cause it, and most importantly, what you can do to help. This topic, while Pisa syndrome isn't a symptom that's super common, it does happen, and this video is prompted by an email I received from a viewer, so I wanted to answer it. So Pisa syndrome is where a person's upper body leans to one side. The most common sign that this is happening is that the person leans to one side, whether they're sitting or walking. Usually the only time it tends to be better is when they're laying down flat. Doctors pretty much observe this by watching a person walk or sit. As you can imagine, this makes offering care really challenging with dressing, bathing, things like that, but it's also really hard for the person experiencing it, the person with dementia or Parkinson's disease. It makes walking harder, sitting harder. It even disturbs their balance. Sometimes it's painful. Now, while this can happen in people who have dementia, it's most commonly seen in people who have Parkinson's disease, and it can also be a side effect of some medication. Let's talk about how common it is and how it can be treated. Actually, I'm really curious, do you notice this in your loved one? Does your loved one, that when they walk or sit, seem to lean significantly to the side? I'm curious how many viewers we have out there that are seeing this in their loved ones. About 1 in 10 people with Parkinson's disease develop Pisa syndrome, and it's thought to be due directly to the disease itself, which impacts the basal ganglia area of the brain, and that is responsible for movement, but also can be due to long-term use of certain Parkinson's disease medications. Let's talk a little bit more about those medications, because it can be caused with medications that don't have anything to do with Parkinson's disease necessarily. For example, there was a 2024 study that looked at 191 cases of people who had Pisa syndrome caused by different drugs. And what they found was Alzheimer's medications like donepezil, the brand form Aricept, which many people are familiar with, that can cause Pisa syndrome. Antipsychotics, which are typically prescribed for mood, agitation, aggression, and then, like mentioned already, Parkinson's disease medications. In over half of the cases, the symptoms started within 1 month of starting or changing the medication. So the good news is that many people get better when the medicine is lowered or stopped. And again, Careblazer, you know that by watching these videos, it is by no means giving you medical advice or healthcare advice. This is just information that's good for you to know. And if this is something you think is pertinent to your loved one, bring it up with their doctor. Okay, so let's talk about what you can do as a Careblazer if you notice this going on. Number one, if you notice Pisa syndrome or significant leaning that you think might be Pisa syndrome happening, bring it up with your loved one's doctor. The type of treatment that is going to be offered is going to depend on what the doctor thinks is causing it. So if the doctor thinks medication changes are causing it, they're going to start making changes to that medication. That can sometimes fix the problem completely. If they think it's more related to the disease itself, then physical therapy and occupational therapy are helpful interventions. Physical therapy, the therapist might work on posture, on balance, on strengthening the core. For occupational therapy, which is such a strange name, by the way, it has nothing to do with somebody being in work or at a job, but basically an occupational therapist, which are some of the most helpful providers in dementia care, can help your loved one do everyday things more safely. Things like eating, dressing, bathing. So they'll take into consideration their current leaning and figure out how to make everyday life easier for them. There might be support devices that are recommended, like braces or special chairs that make your loved one more comfortable. There might be some talk about how to make the home more safe, basically clearing clutter, maybe adding some grab bars, basically doing whatever we can to avoid trip and fall hazards. And in some rare and severe cases, a procedure, surgical procedure called Deep brain stimulation might be recommended, but it's not common in dementia. Here's what's important for you to remember. Pisa syndrome can look scary, but you're not powerless in things that you can do to help. As the Careblazer, you're often the very first one to notice these changes. So if you notice that your loved one is leaning to one side more significantly than usual, bring this up. There are several studies that I referenced in making this video, and I'm going to include those references in the description below this video in case you want to go do more deep research on your own. Now, Careblazer, in the Care Collective, we often talk about some of these symptoms and presentations that family members are noticing. We talk about the research behind it, what might be causing it, and more importantly, what we do is we support one another every single week live. We offer support groups, live Q&As, different dementia experts. So if you are somebody who is not only looking just for more information, but you're looking for more connection with other people who understand all of the challenges that come with dementia caregiving, I encourage you to check out our Care Collective as well. I'll link to that below. All right, I'm sending you so much love. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free, and Nico says thank you very much.